And as usual, to circle it back to the lived experience. A month ago, my little daughter, who you met earlier, was very excited to receive her Braille reader, the Focus 40 from Quantum. All right. And our last before the carbohydrates, we're going to have a talk about supporting eye disease research at the Save Sight Institute. Amanda Craze will talk to us. She's the Associate Director of Development for the Faculty of Medicine and Health at the University of Sydney. We're in the University of Sydney right now, just in case you didn't know. Her role is to support funding, research and education for two flagship centres, the Save Sight Institute, we put on today, and the Child and Adolescent Health Centre, and work with academics at the Westmead Precinct. For Amanda, one of the best parts of her role is meeting with donors and patient families to support their interests and passions for causes they care deeply about, and working towards how they can align this support for meaningful impact through philanthropy. Thank you, Amanda. Go for it.
Thank you so much for the introduction. I'm very happy to be invited to join here today and share some insights. Oh, there's my slide. For the role of philanthropy in research. So I'd like to start by sharing the current funding landscape for research. So in Australia, eye research is primarily funded through a combination of public and private sources. Public funding comes from government agencies such as the National Health and Medical Research Council, called NHMRC, and the Medical Research Future Fund, MRFF. These are extremely competitive government schemes providing grants and fellowships to support researchers. The NHMRC will only fund approximately 11 to 13% of all grant applications they receive, and the MRFF anywhere between 2 to 25%. So as you can understand, this is an incredibly high competitiveness for these grants, and the success rate for our researchers is extremely competitive. This can lead to many talented and researchers to leave the sector, taking with them invaluable knowledge and skills built up over many years of work. And it's actually really critical that therapies that we need to find with research funding is not taken away due to this lack of funding. So the challenges that our researchers face, it's estimated that at least 1 billion people live with preventable vision impairment worldwide. So currently there's about 840,000 people in Australia impacted with vision loss, with the prevalence increasing despite 80% of cases being preventable or treatable. This number is estimated to rise to about 1 million people in 2030. And this will continue to climb without research being funded. We know it has been and continues to be difficult to secure dedicated, prioritised funding for eye research with a range of conditions affecting children through to adults in our community. There are limited resources available for research and funding. Organisations must allocate these resources across a wide range of medical conditions and scientific disciplines. This means that eye disease research must compete with other important areas of medical research to find funding. And with many eye diseases causing lifelong disability through vision loss, it's critical that we tackle this problem. The cost of research is a significant challenge. Cutting-edge research that translates to patient care, especially clinical trials and genetic studies, is really expensive, as we know. Compounding this is a lack of awareness for eye diseases that can translate into public support and consequently less funding. So addressing these challenges requires a collaborative effort from government, private sector and non-profit organisations to raise awareness, allocate resources effectively and promote research and development in the field of eye research. So how can philanthropy help? Public advocacy, education are crucial in garnering support for funding research, and we are delighted that so many of you had joined us here today. Non-profit foundations, philanthropic or individuals do play a significant role in funding eye disease research in Australia. So support from our donors and our patient community can play a hugely important role, and it's vital bridging this current funding gap. Secure funding long-term sources can ensure that we attract and retain the best minds, that researchers can shape their research agenda based on the greatest need and the most immediate impact rather than on available funding. We get mid to long-term research projects that can be designed and undertaken which yield more detailed and meaningful data. So, for example, the Safe Site Registries for glaucoma, retinal and corneal disease was established to provide real-world data to inform the outcomes for treatments for eye diseases long-term. The work done by the registry also requires funding to train students in research to enable them to provide future solutions to reduce the growing burden from eye diseases such as dry eye and our other diseases that we've spoken about today. Secure funding means that research can be accelerated to consistently progress and that it doesn't stop. So philanthropic funding allows our researchers to prioritise, let's see if I can move my slide. Oh, there we go. Philanthropic funding allows our researchers to prioritise eye disease research. With a growing population and an increasing number of people with eye diseases and conditions, it's vital that our researchers are able to continue this important work, better diagnosis and therapies. Our researchers at Safe Site Institute are known internationally for their research and global collaborations in the fight to cure vision loss and eye diseases. So thank you for your time today. If anyone would like to learn more about how you can support research at Safe Site Institute, please get in touch via the details provided here on the screen, or you can scan the QR code if you'd like to know more or if you'd like to make a donation today. So thank you for your time.